Thank you. I want to thank the organizers for giving me the opportunity to speak at this inspiring meeting after this talk this morning by Thomas, for example. Before I start, I want to, so my name is Heidrun. I'm in the investigative tox department of biopharma in Germany. Therefore, I'm talking about a toxicology question. Before I start, I want to thank my colleagues, which are mentioned here, especially Thomas and Marian, but also the others, for supporting me with insight and data for the following data I'm going to show. This will be about a comparative in vitro characterization of two candidate drugs with respect to drug-induced liver injury, abbreviated as DILI, using two advanced in vitro liver models. These two candidate drugs are inhibiting AK1C3, which is an aldoketo-reductase involved in inflammatory and proliferating signaling and is overexpressed in endometriotic lesions, and therefore is a target for inhibitors for endometriosis and polycystic ovary syndrome therapy. The frontrunner, as its name tells, was the first compound developed. Further data can be found also in this publication, which has been accepted. Preclinical safety assessment in 13-week studies in female rats, because it's a therapy for women, and female cynomolgus monkeys, according to regulatory requirements, didn't show any signs of liver or other major toxicities up to a margin of exposure of 16. And in vitro, we could see inhibition of some hepatocyte transporters, for example, BSEP and MRP2 mentioned here, but in primary human hepatocytes, but still this was associated with a safety margin relative to the predicted unbound human therapeutic exposure. Thus, overall, no prohibitive preclinical safety findings were found, and the clinical development was started in phase 2A studies. Still then, we observed liver enzyme increases higher than the 5 times the upper limit of normal, which is the abbreviation ULN, in some of the patients starting after 8 weeks of treatments. Further analysis, including modeling and simulation, identified inhibition of this mentioned BSEP transporter as one potential cause of DILI, and therefore the development was immediately stopped. In the meantime, further compounds were evaluated, and a follow-up compound was further characterized. This one, now I'm showing the data of, had also no preclinical safety findings in vitro and in vivo, and especially there was no BSEP or other transporter inhibition up to 50 micromolar in primary human hepatocytes. Maybe some of you can't see it. Therefore, to support the clinical development of the FU compound, we engaged into a comparative in vitro characterization of FR compared to FO with respect to DILI risk in 2 advanced liver models. One of the models we used was the emulate liver chip. I guess you have come across this model here at the meeting or have known it before. That's a microfluidic model with 2 channels separated by a membrane. Maybe I can use this. Doesn't work. Anyway, hepatocytes are seated in the top channel in a sandwich configuration shown here with 2, and in the bottom channel, the major non-parenchymal cells are seated, which are stellate cells, sinusoidal endothelial cells, and Kupffer cells. And then flow is applied via the vacuum channels on the side. Readouts can be a time course for the flow through for various markers, including, of course, the liver enzymes, and also the cells can be used to measure ATP levels as a viability marker, to measure transporter activity, and so on. This model has been tested for DILI productivity by emulate with 27 reference compounds with a sensitivity of 87% and a specificity of 100% in this data set. This has been published recently by Lorna, Ewart, and al. The other model we used were in spheroliver microtissues. Again, you should have seen them now on several posters, and there was a presentation yesterday. These are 3D spheroids in a static culture, which can be kept up to 28 days. Again, they are composed of primary human hepatocytes, can be provided as a mix of 10 donors together with non-parenchymal liver cells. Readouts are similar to the liver chip. Maybe the lower cell number has to be taken into account with respect to sensitivity. Again here, there was an investigation, or there is an ongoing investigation by Inspero with respect to DILI evaluation. Currently, 87 FDA-approved drugs with DILI rank labels have been evaluated, and it turned out that the ATP level IC50 after 7 days of treatment can be relativized to a Cmax total, and with 90 as a threshold for this ratio, and this allows to place compounds into the most DILI concern or the no DILI concern class with a certain number, percentage, as you can see here. And this has been presented yesterday also in a talk and can be also found on a poster at the SOT, Society of Toxicology meeting this year. We started, now I start with results from the emulate liver chip model. We, for example, measure transporter activity after treatment of the cells with 3 days with a fluorescent transporter substrate, CMFDA. This substrate enters cells independently of transporters, but then is cleaved by esterases in the cytosol and can leave the hepatocytes only via active apical transporters. This means that increased cytoplasmic staining will indicate inhibition of these transporters. And as you can see here, after treatment with an FR compound at 10 and 30 micromolar, there's increased cytoplasmic staining seen indicating inhibition of apical transporters. Whereas with the FU compounds, you don't see an accumulation in the cytosol. This staining you see in the controls and with the FU compound are staining bile canaliculi, which are formed by the apical membranes of the hepatocytes. A further parameter we tested was albumin, which is a marker for hepatocyte albumin secretion, which is a marker for hepatocyte functionality. The left two diagrams show a dose dependence for both compounds over time. The right diagram shows a mean of several experiments where the FU compound was only dosed at 100 micromolar. Top diagram shows FR, but I first want to point out, please look at the green bars over time. These are the controls over time, and you can see an albumin secretion of 40 to 60 microgram per day per 10 to the 6 cells, which is about the value you need to reach to show functionality of your model. And there was hardly any decrease, or only a small decrease over the time course we use this liver chip. But with the FR compound, shown with the red bars, you see a dose and time dependent decrease relative to the controls, starting already at day 1 with 30 micromolar. And at day 2, there was hardly any albumin secretion with the 2 highest concentrations anymore. Whereas for the FU compound, you can see on the bottom channel, we saw some decrease of albumin secretion at later time points, but that still stayed up to 50% of the total, of the controlled secretion. As a further parameter, we measured CK18 and ALT, which is a liver enzyme release into the supernatant, and that of course relates to the clinical measured ALT release. Again, we couldn't see any CK18 or ALT release from the non-treated liver chip, indicating that there was no cytotoxicity going on. But what you can see on the left part for CK18 and on the right part for ALT, that FR, shown with the red bars again, induced a strong and steep dose-dependent increase of CK18 and ALT release, which was not observed for the FU compound. Next, we measured ATP levels in the hepatocytes themselves, again as a viability measure. I do want to point out we have run 4 independent experiments with the liver chip. For For 2 of them used the emulate, the cells previously tested for functionality by emulate, and for 1 experiment with 2 chip replicates, we used other cells obtained from other providers. Unfortunately, you may not be able to see that everywhere. So the diagram on the right shows the ATP ratio relative to the controls for FR and FU. And again, we see a steep dose-dependent decrease of ATP levels, indicating decreased viability with the FR compounds, and which was not observed with the FU compound. The tables on the left and middle show the values from the single measurements, and here you can see that FU compound decreased the viability to some extent, but only in 2 of 4 measurements. I think I'm pretty fast. Then we wanted to, of course, count this is 1 liver model, and I think we all know we cannot rely on 1 model. We need to measure in other models. These are now the results from the liver microtissues. The top panels show the ATP levels in the cells, and the bottom panels show LDH release as a measure of an enzyme release over the time course for the FR compound on the left and the FU compound on the right. Again, you see, as with the emulate liver chip, you see a steep dose-dependent decrease of cell viability with the FR compound reaching an IC50 at about 18.5 micromolar, which was not seen, or there was only a very weak decrease with the FU compound over the same time course, not reaching an IC50 value. Cooperating that, we see that the FR compound led to LDH release, very steep dose response again during the time day 0 to day 5, which was not seen with the FU compound. At later time points, you don't see much release anymore because the cells were already dead at these concentrations and so can't release more LDH anymore in the medium. Now we here also could use the ratio of the ATP IC50 relative to the Cmax total, as since the data were available from InSphero with the most DILI versus no DILI rank compounds. And we could see that for the FR compound, this ratio was smaller than 10, placing the FR compound into the most DILI concern class, versus for the FU compound, this was far out of the relevant range. Anyway, we didn't see an IC50, so placing this compound into the no DILI concern class. I'm coming already to my summary. So we compared the FR compound, which had been stopped in the clinic due to liver enzyme release in some patients in phase 2A, with a follow-up compound in 2 advanced liver models. The ones we used were the emulate liver chip and the InSphero liver microtissues, and both had been tested also before how they could predict DILI with a certain number of compounds by the providers themselves before. This showed that the FR compound, but not the FU compound, inhibited hepatocyte transporter activity already at 10 micromolar, and that FR decreased albumin secretion much more strongly than the FU compound, which is the hepatocyte function marker. And for viability markers, we could see that FR, but not FU, significantly reduced viability, seen with ATP level decrease and also enzyme and CK18 release into the medium. And this ATP reduction also allowed us to to make a comparison to FDA DILI groups, most DILI concern and no DILI concern compound based on the INSPHERO currently still ongoing evaluation. So this places FR into the most DILI concern group and the FU compound into the no DILI concern group. The conclusion we draw about from that first of all, the DILI liability of FR could be observed in the two advanced in vitro liver models. That was, of course, a requirement that we make comparisons. If we wouldn't have seen that, we couldn't test other compounds and make conclusions out of that. And that comparative analysis showed that FR was associated with an increased DILI risk, but that we couldn't observe a signal for the FU compound in both models. At the end, I want to thank again my colleagues involved, but also skilled technical assistance of my colleagues in the lab. And I guess you know these MPS models, they need a lot of adherence to technical skills, and otherwise you cannot conclude anything from the data. And I want to thank you for your attention.
So we had time for a couple of questions.
Thank you. Ivan Rusin, Texas A&M University. I was wondering if you have run just standard 2D sandwich hepatocyte cultures in parallel with these, or do you have prior data in-house showing that that model could not actually demonstrate any cytotoxicity up to 100 micromoles?
We haven't done that. That's right. We probably could now do it, but we thought we just go, because especially the INSPHERO model, the emulate model allowed this integrated measurements of various parameters at the same time. So we opted out for that.
Hey, I have the same question here, which I had to your colleague yesterday. Could you go into more personalized fashion, I mean in terms of polymorphisms of your 10 donors? Because if you have, let's say, one outlier for polymorphism for these apical transporters, then you lose this predictive value for this donor, and then what's the question about the entire system?
Well, now you're right that I think it could be done. We chose the model with the 10 donor mix, but of course, if we want, we can measure single donors and also genotype donors, which we haven't done here because the results were comparable between the two models, and the emulate model was run with single donors, whereas this model was run with a 10 donor mix, and I'm sure these donors had nothing to do with each other. But if you want to go there, of course, you need to measure genotype single donors. But we didn't have an indication also that this has to do with polymorphism. So in any SIP enzyme, for example.
Okay, we have time for...
I would highly recommend to screen the polymorphic first in your donor, just to get this basic information, what you're actually altering.
Okay, I need to consult with my colleagues also what has been done there already.
Okay, we have time for...
So the 10 donors, they are curated, right? So the idea is that you can create a very stable set of biological function that can then be taken from batch to batch. But there are a lot of single donors available as well. So that possibility is there. In an industrial setting, I think you have to choose your battles. And if you do hazard identification, then that's a great way forward.
Okay, last question.
Thank you very much for this very nice case study and this presentation. You showed that you had for your clinical trial, you had no hints before in the preclinical setting for any kind of liver injury, and as far as I got that, you had 13 weeks animal study before you started. Now knowing the results of your MPS systems and going back to the animal study, would you now have a conclusion or consider that it was the wrong species or the protocol could be adjusted, or is it something you really can only see on an MPS system? Thank you.
Maybe we can I mean, we also have seen it in the 3D spheroid model. I think we will, case by case, of course, and especially now for compound like this, we also learned that at the end, the BSAP inhibition was a major problem that we learned on the way going through all the data. I wouldn't say that we would use MPS all the time. We, of course, try to sample all the data before, maybe looking even more at transporter inhibition, and that's what we are going to do now. We have started an investigation more, bringing the DILI-like parameters, which could be transporter inhibition, but also mitochondrial toxicity and so on, to bring them much more closer together first for considerations, and then consider such studies in MPS models. So we won't do it as a routine testing, but case by case.
All right. Thank you, Heidrun, for this excellent presentation.